that time of year. The colder weather brings with it sore throats. In kids, it can be a real pain in the neck.
So we definitely see a lot of strep. We see a lot of just inflamed tonsils or tonsillitis, but those two are the most common reasons for sore throats.
Being more serious than a run-of-the-mill sore throat, strep should be looked at by a doctor. As a general rule, answering 2 questions may give parents some guidance in making the call.
Strep tends to be more along the lines of no coughing or congestion, just really sore throats, high fevers, generally above 102.
So the 2 questions would be, does your child have a cough or cold symptoms? And have they had a fever in the last 24 hours? While fevers are a hallmark of strep infections, coughs are not.
The majority of the times, if you have a fever and you don't have that other cough or cold symptoms that go along with a normal viral infection, most of the time it's going to be strep.
To make sure they have the right diagnosis, pediatricians perform an in-office test.
We'll tend to do a strep culture, so we do a rapid test in the office and then send out a confirmatory test just to make sure. But it is definitely important in treating strep throat with antibiotics.
Strep is most common in children between the ages of 5 and 15. Although it's a bacterial infection, strep is contagious, so plan on keeping your young one home from school.
We say 24 hours of antibiotics and then you should be fever-free for about a day. So most of the time that ends up being 1 or 2 days of school that they miss.
Strep may also produce white patches in the throat and tonsils, but doctors say don't use that as your barometer. When in doubt, check it out with the help of a medical professional. For Lee Memorial Health System, I'm Amy Osher.